morning to one and all present here. The session will commence from 11 o'clock.
ಟೈಮ್ ಎಷ್ಟು ತೋರಿಸ್ತದೆ ಇಲ್ಲಿ? ಪರವಾಗಿಲ್ಲ ಸರ್.
Excuse me, Anita ma'am, you have shared your screen. Can you please?
Good morning, dear participants. I would request all of you to please mute and switch off the videos. The session will begin in a few minutes. I kindly request all the participants to please switch off their videos and please mute your audios. The session will begin in a few minutes. Good morning to one and all present here. I, Anagha S., Assistant Professor from the Department of Psychology, Kateel Ashok Memorial College, welcome you all for today's session. Manasa Trust, Kateel Ashok Memorial College, has always taken a lead towards community mental health. As a part of the same Mental Health Yatra 2022, today's guest lecture will be conducted regarding forensic psychology. I would like to welcome our resource person, Mr. Yaseen M G, Senior Scientific Officer at State Forensic Science Laboratory, Bengaluru. I welcome Dr. Rajni A. Pai, Director of Manasa Trust, Dr. Preeti V. Shanbhag, Academic Director of Manasa Trust, Dr. Sandhya Kaveri K., Principal, CAPMAC, Sister Mari Evelyn, Coordinator of PG Studies and Research in Psychology, and all my dear colleagues and participants. A heartfelt welcome is also extended to our beloved HOD, Dr. Archana K. Bhatt, and other faculty members. I now request Dr. Sandhya Kaveri K to give the prefatory note.
Good morning to all of you. I'm switching off my video to have the audio with more clarity. Respected resource person of today's webinar, Mr. Yaseen M G, Senior Scientific Officer at Karnataka State Forensic Department. Respected the Director of Manasa Trust, Dr. Rajni Epai, Academic Director, Dr. Preeti Shanbhag, Sister Mary Evelyn, Coordinator for Postgraduate Department of Psychology, our Academic Advisor, Dr. Rajendra Chenni sir, HOD, Dr. Archana Bhatt, all the dignified participants of this webinar. We feel privileged to have a great resource person for a very important topic of today's webinar on forensic psychology, foundations of forensic psychology. Kateel Ashok Memorial Institute is a fledgling college started by Manasa Trust in 2017 with the very idea of having psychology education and reaching a great population in training and teaching psychology. We have degree, that is undergraduate program, BA and BSc in psychology with other humanities and basic science subjects. We have BSW, Bachelor in Social Work, BCom, Bachelor in Commerce, MSc in Psychology and MSc in Clinical Psychology. Our college is affiliated to two very important universities, Kuvempu University, State University, and Rajiv Gandhi Health University of Health Sciences for our MSc Clinical Psychology. We'll also going to get MPhil in Clinical Psychology soon, as we have already applied and approached RCI for the process, and we are awaiting their recognition for the course. Manasa Trust, which was started by Dr. K. A. Ashok, a very renowned psychiatrist, Abhisi Roy awardee, who had great vision towards community mental health and had the idea of reaching mental health to the doorsteps. He has started this Manasa Trust with the objective of reaching mental health to the doorsteps. With this, he has developed different programs, started different programs and projects to create awareness among the community, to train professionals in the area of counseling and mental health. Because of this idea, Manasa Trust now not only have a full-fledged psychiatric hospital, Manasa Nursing Home, we have Manasa Dhara we also have this college, Kateel Ashok Memorial Institute, which has been started in 2017 in the memory of Dr. K. Inside the four walls, we conduct several programs. As a part of our co-curricular programs, we conduct different trainings and workshops. We also conduct this kind of mental health yatra to create awareness about different concepts of psychology among the students of psychology and other people who are working in the mental health field. With this, we have conducted several series of programs in the last 2 years, offline as well as online programs, to reach to a great population and train them up or create awareness or sensitize the group among several issues related to mental health and the mental health needs. In this way, here we are all here today to have a webinar on basics of forensic psychology. Forensic psychology is always a very interesting and curious field of for all the psychologists and mental health professionals, because many a times we get questions why the person is behaving like this, what is the reason behind many of the acts which are against the law of the land. And we also find it challenging while working with the people indulging in behaviors against the law of the land. So it is very important to understand different angles of such behaviors, for which I think the awareness regarding forensic psychology is very essential for any mental health professional. So therefore, here we have a very eminent person who have a great knowledge in the field. We are we are privileged to have such a great resource person with us today. Hope this session will help each participant and quench your curiosity regarding forensic psychology. So, once again, I cordially welcome on behalf of Manasa Trust, Kateel Ashok Pai Memorial Institute, and all the participants, Mr. Yaseen sir, for this webinar. I also recognize the support of our director, Dr. Rajani Epai, and academic director, Dr. Preeti Shanbag, for giving such a great opportunity to arrange such webinars and the workshops regularly at our college. I congratulate the whole team from the Department of Psychology, where we have Sister Mari Evelyn as a coordinator, Dr. Archana Bhatt as HOD, and other faculty members, Mr. Manish, Ms. Anagha, Ms. Vinota, and Ms. Ashwini for arranging this webinar. I always congratulate my dear students of psychology, who also is a very important part of this webinar. I thank the participants, all other participants and delegates, for taking your interest in participating in this webinar. Thank you, one and all. I hand over to Anagha.
Thank you, ma'am. I now request Ms. Aditi V. Rao, Assistant Professor at the Psychology Department, to introduce our resource person. Over to you, Aditi.
Mr. Yaseen M G is a senior scientific officer at State's Forensic Science Laboratory in Madiwala, Bangalore. He is a RCI licensed professional who completed his MSc in Surana PG College, Bangalore, MPhil in clinical psychology from Osmania University, and he is currently pursuing his PhD from Christ Deemed University. He has worked in Reva University, SVS Neuroscience Hospital, and Manasa Psychiatric Clinic in Hyderabad. He has the experience of teaching in Reva University and is working as a forensic or clinical psychologist. He has obtained Karnataka State Level Services Award from Human Rights and Anti-Corruption Forum, headquarters in Delhi. He has presented papers in international conference. He's trained in forensic and clinical psychology assessments and psychotherapy. He also has a flair for languages like Kannada, English, Hindi, Telugu, and Urdu. He has his interest in neuropsychology and juvenile delinquents. Over to you, sir.
Hello, am I audible?
Yes, sir,
Yes,
you are.
ma'am.
Thank you so much for a wonderful introduction. First of all, good morning to everyone on the other side of the web. I am feeling warmth and compassionate for being part of this mental health yatra program organized by Kateel Ashok Pai Memorial Institute. I would like to thank HOD of psychology, that is Archana ma'am, and Principal Sandhya Kaveri ji, as well as other dignitaries who have invited me for this program. So, keeping diverse population in the mind who are attending today, I would like to start the topic from the basic, what forensic psychology is. So I'll be sharing my screen. Is it seen? Hello.
No, sir.
Okay. Is it seen now?
Yes, sir. It's
Yes,
still
yes.
loading.
Okay.
It's visible now, sir.
Okay. So nowadays, if you are updated with social media as well as newspapers, you see crime rates are actually rising up. So there is a statutory body called NCRB, National Crime Rate Bureau, whose statistics denotes that every day around 70 to 77 homicide, that is murders, happening all over the country, as well as around 88 to 85 rape incidents are reported to the police stations. So today we are talking about crime as well as psychology as well as some of the legal aspects. So the agenda of today's webinar is I'll be covering forensic psychology introduction, the nature of forensic psychology, scope of forensic psychology, and this would be very apt for all the viewers, that is assessment and treatment programs, that is concerning to the risk assessment as well as modern techniques which are used in the forensic psychology, as well as some aspects will be thrown to mental health implications which can be used in forensic psychology. So to understand forensic psychology, we have to head back to the psychology basics. So there are broadly two major areas found in psychology. One is pure and applied psychology. So what is pure psychology? It provides theoretical framework of the subject. So applied psychology usually deal with the application of psychological principles, techniques to approach problem in different fields of practical shape. So pure branch of psychology mainly has this many subjects like physiological psychology, developmental psychology, which deals with growth and lifespan of human beings, abnormal psychology, neuropsychology, etc. So when we come to applied branch of psychology, as forensic psychology is also an applied branch of psychology, it has other disciplines, interdisciplines like educational, clinical, counseling, sports, military. So if we have to clearly understand what is the difference between pure psychology and applied psychology, pure psychology actually expands the current knowledge, what we know about studying about systematic study of human behaviors. Here in applied psychology, we apply the psychological principles to solve practical life problems. So pure psychology usually is theoretical and explanatory in nature. Applied psychology is pretty practical and descriptive in nature. Pure psychology is actually a curiosity driven oriented, but applied psychology is client oriented. So we study the origin, cause and result of behavior in pure psychology. We use information to deal with clients in applied psychology. So results when we research in pure psychology are applied to the great many population. So here in applied psychology, it is applied to the group of particular situations concerning to the respected discipline. So these are the things which are self-explanatory. So you guys know what is the nature of psychology. So we study about methods, which is actually driven by scientific observation. We record through testing, classification of analysis is done, verifications. We study facts not by imaginary phenomenon, none, but instead of psychometric aspects like using psychometric tests like intelligence, memory, learning, and it is universality based. We validate the tests and reliability of the test. We verify it and we bring into the this thing. So this was the basic of how the forensic psychology has evolved from the branch of psychology. So there are some key terms to be focused on here in forensic psychology. We usually deal with few terms like insanity as well as competence. These two terms are pretty common found in forensic psychology because we do insanity testing. in forensic psychology. So insanity usually means it relates the defendant's mental state at the time of offense occurred. So what is competence? Competence refers to the defendant's mental ability at the time of proceedings, court proceedings, legal proceedings. So this is the definition of insanity as well as competence. So there is I don't want to keep the slides boring, so I wanted to include all the participants. So we do test eyewitness testimony in forensic psychology. So I would like to show a picture of an crime scene, and I want to ask all the participants to put in their answers in the chat box, like what all they see in this picture, how clearly as a psychologist observe scientifically, and they give their testimony that what all things were there. I want an S from the participants or the in charge of whoever is handling the program. Can I show the picture?
Yes, sir, you can.
Okay. So there is a, you can see a picture here. Imagine this is a crime scene. So you are being called here for a witness in front of court. So you are seeing some things which are very important in this picture. I would like to ask some questions after this. Okay, so there goes 15 seconds. So it's enough for a psychologist or a budding psychologist to observe the situation. So the questions what I would like to ask the participants, that how good is their observation. So how many stickers did you see to the glass showcase stuck actually? Please put your answers in the chat box so that it would be very interactive session. Yeah.
Sir, I would please request you to drag the dialog box to the lower end of the screen as the content is not visible, sir.
Okay.
Thank you.
How do I do that? Excuse me. Sorry.
So you can hide the dialog box or minimize it.
Sir, can you see the stop sharing on top?
Yeah. 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 Yeah.
Yeah, right next to that, there's a minimize. Don't click that.
Okay. Okay.
You should share the screen again.
Okay.
Next to that, there's a minimize option. So if you click that, that box will be minimized.
Okay.
So you'll have to share the screen again, sir.
Okay. I'm doing it.
Yeah.
So there is a minimize button here.
I will tell you 1 second, sir. Can you go to your PowerPoint presentation?
Yeah.
Yeah, I think it's minimized now, sir. You can continue.
Okay. I would like to ask these questions. So what is the color of the fridge did you see on the picture, and what color was the shawl and pant which was hanging to the door, as well as which company cold drink or soft drink you found lying next to the fridge? Are there answers coming? I'm unable to see.
Yes, sir. Participants have messaged. Just a minute, I will read it out for you.
Okay.
So they say there's a Pepsi bottle. There are three stickers. Fridge is in
Okay.
white color. Color
Okay.
of the cloth was brown. And
Okay.
Pepsi bottle next to the fridge and black shelf or black
Okay.
shawl. I'm sorry.
Okay. Okay. Was there a black shawl? I think it was a black pant.
I guess.
Okay. Very good observation. So this is what we do. One of the aspect in forensic psychology is eyewitness testimony. When a person claims that he was the eyewitness of a crime, so how well as the person has observed that and how authentic is the information given. So we actually do that. So there and yeah, it was actually a black color pant as well as skin colored shawl. Pepsi bottle was right, and there were three stickers. You can say it as a cement color or white color fridge. Yeah, good. So we're heading to the forensic psychology now. So mainly all those information which you told, eyewitness information you told was actually taken from your brain, and brain is the storehouse of all the system information. So we extract information from your brain and we present it in front of court as an evidence. So if you want to know the basics of forensic psychology, forensics is a term derived from Latin which is called forensis, which means forum. So it denotes relationship between psychology with the adversarial legal system. It is an amalgamation or a mixture of psychology knowledge as well as law. So American Board of Forensic Psychology has defined the term forensic psychology as the application of science and profession of law to questions and issues relating to the psychology and legal system. So it is a study of a behavior and mental process those who engage in criminal behavior. So it deals with assessment, evaluation, and detection of mental illness and human behavioral pattern. It also concerns with collection, examination, and presentation of evidence for legal purpose. So if there is a crime scene which has taken place and there is no evidence generated, even though when the experts are called, like murder has happened and they don't see any blood spots or weapon or any other disturbance in the social environment of that situation. So there comes a forensic psychologist. So his observation as well as his evaluation takes place, and thus we subject the suspects, victims, or an accused with scientific test, and we generate evidence and we produce it in court for judgment. So if you see the history of forensic psychology, there are some pioneers like James Kateel, who is expert in intelligence field, as well as Hugo Munsterberg, who is also called as the father of forensic psychology for his contribution on eyewitness testimony. So there are other people like Alfred Binet, William Stern, William Marston, as well as Louis Terman. So these are the pioneers who has actually worked on forensic psychology. So since the inception of the psychology as a subject, it is been supporting the other branch. So thus there are an uh, evolution of new subjects, and forensic psychology is also one of it. So what do we need a knowledge base for being a forensic psychologist? So he should possess knowledge of clinical psychology, criminology, which deals with criminal and social environment, their behavior, as well as a bit of law concerning to the criminal aspects. So there is something called IPC, Indian Penal Code, so where we have mentioned section wise for each act, and for those act we have particular punishments based on their behavior. So there is one section called section 84 IPC, which denotes that if a person has done a crime in an unsound mind, if he has committed a crime in an unsound mind, like he was a mentally ill or mentally disturbed during this time, so we have to prove it in front of court, uh, if he was unsound or he was sane during those time. So there is some rule called McNaughton rule. So those are a little bit technical in nature. We have to know about those things. So after clinical psychology, criminology, sociology, law, we have to also have some knowledge about psychiatry, because there are so many people who are deviant, who commits the act and suffering from mental illness. Those people need psychiatric help, medications, therapies, etc. We also have to have a penology knowledge also. Penology deals with punishment uh, aspects. So what all assessment issues do forensic psychologists face? So there are like genetic factors, medical and psychiatric history if a person is having, if he has acquired physical or mental disabilities, if he's having intellectual development problem, if he's having personality issues. Those are the assessment issues forensic psychologists face while facing with the court. So what all range of cases do forensic psychologists deals with? So they deal with murder, manslaughter, serious persistent crime, intra-family abuse, arson, sexual violence, addiction related crimes, etc. So any range of crimes forensic psychology uh, usually they deal with. What all important skills do a forensic psychologist require? He should have a good analytical skills. He should be good orator or communication skills, because he has to deal with scientific interview techniques, interrogation techniques. He has to critically think, inductively reason out why he did the behavior. He has to have a good interpersonal skills. He should have a good observational skills. He micro expressions of his facial expression during the interview, his body language, all comes in hand. So he has to have each and every detail orientation noted down in his diary, as well as he should have a problem solving skills. So these are some of the skills which has been required or asked for a forensic psychologist. So what is the difference between psychologist and forensic psychologist, if you want to know? So the roles actually varies. So psychologist usually helps the client generally through some counseling or so. Forensic psychology tries to understand the case or involvement of suspect through scientific tests, psychometric tests, as well as DDT tests. He follows diagnostic statistical manual as well as international classification disorders. There's a manual for diagnosis, but here in forensic psychology we have no diagnosis, and all over India there is no general licensing body as such for forensic psychology as we have for clinical psychology, Rehabilitation Council of India. So there is no such licensing body for forensic psychology. So they don't diagnose the people, but they focus on evaluation of mental status of an informed the client, as well as they translate the legal terms into psychological concept. They use the psychological principles and they inform or they transform those psychological language in legal terms for the judge to understand. So human behavior usually judged or done in pertaining to the normal political by psychologists, but here it is dichotomous. Either he is guilty or not guilty, either he is a murderer or not a murderer. These polarities are being seen in human behaviors in forensic psychology. So the behavior explanation usually is being described briefly in forensic psychology, but here in sorry in psychologists. So in forensic psychologists, they actually doesn't require why or he has done that behavior unless some deep investigation is required. So a little more about forensic psychologist and psychologist. So in psychology, usually try to prove their level of proof by applying their behavior, I mean by their theories up to that 95% of statistical terms. So here in forensic psychology, they try to tell only expert opinion only. If they have tested through some tests, they will tell is he coming under the normal probability curve or not. So we focus in psychologists usually focus on past experience, present state of mind, and future behavioral possibilities. But in forensic psychology world, forensic psychologists usually focus on present state of mind. So what all ethics they follow? Psychologists they usually follow confidentiality, empathetic nature, and supportive nature. So here in forensic psychology world, they are bound to share the results and findings because they are directly dealing with the court. As the court will order the forensic psychologist to conduct some test on this behavior, abnormal behavior or deviant behavior shown by the person, and we have to produce that result in front of court. That is the objective, which will be very detached in nature and focus specific. So the client's perspective is very important when the psychologist observe, but here a forensic psychologist as is dealing with the court, it is not important as such because they are more answerable to the court, not the client, the person. So voluntariness, if we see psychologists, they are not resistive in nature, they are very open, but here in forensic psychology world, they resist although they give consent, their willingness. So if you see the autonomy in psychology, they have free hands as per the case requirement. They can explore whatever test they want. But in forensic psychology world, the what court orders, whether he has to be tested in this pattern only, those tests are only being used. The goals used by psychologists are very common in nature, but here in forensic psychology, it is different. Am I going too fast or is it understandable?
No, sir, it is understandable.
Thank you. So, if we see a forensic psychologist as a whole, he has many domains of a role. For a person being a son, being a father, being a husband, etc. How the roles are being divided the same way in a forensic psychologist also has a variety of role. So, if he is a clinician, so he has the role to study the divorce and child custody mediation. So it is pertaining to the civil cases. So he has the responsibility of studying the divorce pattern as well as the child custody mediation. Child custody mediation is nothing but taking the child's perspective. When a divorce between husband and wife has happened, they'll take a perspective of a child also with whom he is very comfortable as well as safe in going. So also to determine the insanity as well as fitness of a offender to stand at trial. As I mentioned, the two terms which will be repeating like insanity as well as competence. So here comes when forensic psychologist is a clinician and role, he has to determine whether he is insane or sane, what all competence behavior he has to stand at trial, whether he's competent or not, whether he is able to stand in front of judge or attorney and mindfully tell his participation or his not participation deal. So also the forensic psychologists deal with expertise on testimony. So as I told, they also are as an expert witness, they stand in front of court and they tell in front of court that they have testified with a proper protocol, and on their testing a corroborative evidence can be taken and judgment can be passed. So they are also involved in employee selection, for legal professionals. So forensic psychologists usually invest all this information as well as psychological information is actually derived from the Western perspective. So their employee selection is pertaining to the judge also happens there. They are involved in jury selection. So to design and conduct treatment programs, so they tailor the treatment programs based upon the abnormal behavior or deviant behavior. They also offer treatment to the victims who has gone through trauma patients or their family members. So when we see forensic psychologist as a researcher, what scope he examine they examine the efficacy of risk assessment strategies. So they have a role in risk assessment, like what behavior risk does the person uh, possess when he is antisocial or sociopath, etc. So to study the factors influencing the decisions of judges, we help forensic psychologists do help in decision making the judges by showing the psychological angle. Why was why did the perpetrator did this crime, or what was the reason? Is it Was it organized crime, or was it unplanned crime? Was it impulsive in nature? Was it reason oriented, etc.? So to develop test efficient and reliable methods for eyewitness, to evaluate treatment programs of offenders and victims, to study style of interrogation questioning on accuracy of recall of witness details, to examine the effect of personality arousal and other variables on accuracy of eyewitness test, witness memory, etc. To help in legal employee to manage their job stress. All those roles are being done by forensic psychologists. So they also involved in assessment and evaluation. So their main role would be to see a client or the perpetrator or the accused their mental fitness to stand the court trials. We do insanity testing. We do involve in risk assessment. We do offer counseling, psychotherapy, expert testimony, forensic interviewing is done. Parole hearings. Parole hearings is nothing but when a person is under jail or is about to come out of the jail, he testify and give a report that he can come out under supervision, all those things. So we involve in legal report writings, teaching in universities, all those aspects. Yeah, jury consulting and jury selection has also been seen. So forensic psychologist, if he becomes a correctional psychologist, or if he deals with juvenile population, they offer sex offender management. So they deal with these behaviors, behavioral therapies, social skills are been given, etc. The prisoner counseling is been done. Re-entry programs to the society is been offered. Substance abuse treatment programs are organized. Assessment of sexually based crimes, school violence prevention programs, family and children mental health is being looked after. When we come to the domestic violence and interpersonal thing, when violence against women has occurred, forensic psychologists come in hand, and as they have a clinical as well as forensic background, they do help in therapies, and they involve themselves in research studies, which is causing stress and trauma for the victims, and yeah, these are the things: child victim therapy, domestic violence, mental health, as well as childhood trauma. So this might be very helpful for the viewers. So as I was telling, risk assessment and treatment of offenders also are being done. So how do a forensic psychologist uh, assess the risk of pattern of a perpetrator or a culprit? So here this term is very general. Functional analysis is done. So analysis of understanding is being done to reduce as well as to synthesize the case information to provide psychological explanation to offenders' behavior is carried out. So what do? We will inform and guide about treatment planning. What all treatment is required after functional analysis, behavior function, whatever he has projected, will tailor according to the treatment. We allow uh, the integration of theory to happen. We follow the practitioner model also. So to that, we have to have a clear case history taking sessions. The background factors also matters a lot. So the forensic psychologist should be aware of taking sim very minute to minute as well as the major information about an individual who is involved in crime. So offender's past is very much comes in handy. His predisposing factors like his uh, childhood history, or what if a person has gone through some childhood abuse, or he has been uh, brought up in an unhealthy environment, bad parenting, all the hello, there is a disturbance. Hello?
Tanya, please mute your mic. So please continue.
Yeah, I was talking about background factors. So predisposing factors is very much necessary while case history taking. So keeping childhood factors in mind, we also include recent occurrence. Why did the individual do the crime? What was the factors involved while assessing whether he was taking substance regularly like alcohol, drugs, etc. Was he a victim of abuse, or he had any negative role models, whether he was diagnosed with personality disorder or any other mental illness. So we also have to consider the psychological literature theory to support why the factors might have predisposed. So this has to be done very intellectually, and a thorough um, briefing of information is very much in comes in handy. So if we take example Bandura social learning theory, whether the person had a negative role model, or from the childhood he was exposed to a bad environment, bad peer group, and he is doing because of that. So early developmental trauma, or whether he was neglected, due to it he was hyper aroused and bad vigilance, all those things, and whether an individual had an bad experience relationship with his mother, or the child rearing lady, etc. Due to it, he has a mistrust in women. So due to it, he has committed a rape or so. Also, we have to see about his relationship issues uh, and his emotional control difficulties, rapid emotional fluctuation, why is he going through, as well as his coping patterns and his academic patterns too. Due to his poor academic achievements, he was unable to get employment outside, and through this limited employment option, he has committed theft or arson or burglary, etc. So we have to, after doing a complete assessment, we have to follow this ABC model. It is actually done by B.F. Skinner, the behaviorist, antecedent, behavior, and consequence thing. So we three contingencies has been applied. So we do check antecedent, the pre taking behavior factors, beliefs and behaviors of a client, as well as the consequences, how they have pursued. So this ABC model is being used for all uh, the problems where individual commits, like it can be applied for a sex offenders, stalkers, violent offenders, homicide people, etc. So if we follow this ABC model, we'll get to know what all risk assessment patterns can be done. When we come to an antecedent, so we have to check in activating event trigger, what happened led up to and immediately prior to the offense. What triggered the individual? We have to check the external trigger. We have to whether he had an argument with the victim. That's why he became angry as well. He abused or he uh, did some physical activity with the victim. All those things should be explored. Also, we have to focus on stimuli. What response was immediately taken by an individual? What cognitive process which happened, which led to his impulsiveness? The presence as well as the effectiveness of the response he had selected. Also, the offending behavior is usually triggered by combination of clusters of antecedents, the triggering pattern. So we need to identify those antecedents first if you want to treat, or we have to profile. So what are the examples of antecedents? Like abuse, problems, bereavement, social family rejection, negative life events, threats, perceived disrespect or argument, emotional, physical, attitudinal or cognitive behavior, other interest, all those things which has taken place in an individual to become a criminal also. It is very important for us to understand the offender's perspective also, because most of the people when he commits a crime, we actually more focus on the victims but not the offender's perspective. What was the reason he has done? uh, if we get to know the offender's perspective, it is very easy to tailor the treatment programs. So after antecedent, we have to focus on beliefs and behavior. We have to be clear about the offense behavior. We should not have any minimized version of events to be entertained. We should not take very shortcut notes while noting down the behavior as a forensic psychologist. We need to know what is the function of his behavior. We need to know his strong beliefs, his schema, his cognitive pattern, his emotions. How might be the offender have been thinking or feeling throughout, before committing and after committing the crime? How might be these thoughts or emotions contributed to the offense? Negative as well as hostile thinking, anger, all comes in hand. So, despite the fact some behaviors may have happened quickly, the led up to them is long behaviors. Behaviors don't just happen. It is the process of from the perception of an information, encoding, storing, execution, all those things we have to track it down. I think I'm going a little bit fast. So till now we have, from the basics I'm building towards the technicality. So we have covered antecedent as well as beliefs, behavior. Now, yeah, somebody said something.
No, sir.
Okay, now we are heading towards consequences in ABC model. After taking the antecedent pattern, the behavioral pattern of an individual, we come to the consequence, this thing in ABC model. In this element, the functional assessment is being done when the behavior, behavior is learned, behavior is hereditary, behavior is modeled, all those things. We have to look in for that. And how did the offender's behavior actually arise? We have to see his positive reinforcement as well as the negative reinforcement pattern also, which will actually condition as well as reoccur again and again. So these are the things we have to focus on. Yeah, after knowing the model of ABC, antecedent, behavior, beliefs, as well as consequence, after assessing those things, we'll get a clear picture about an individual's functional functionality, behavioral functionality. After that, we can do a assessment. There are different types of risk assessment done. So there is something called first generation assessment, which is done through unstructured professional judgment. Basically, it is done through guesswork. So there is second generation, which actually deals with actuarial assessment, which is numerical in nature, based on algorithm and statistical patterns. So that's how there is a fixed questions as well as fixed norms for it. We generate risk score for that. So we have some questionnaires for that risk assessment questionnaires. So we follow that method, as well as the third generation, which also deals with structural professional judgment, which is qualitative in nature, where we get qualitative information and how the offender has improved over time. We also get to be known through this first generation, second generation, and third generation. Any of this risk assessment pattern can be followed. So if you know first generation unstructured clinical judgment advantages, so it requires in-depth knowledge of research based behind the violence. Also, we have advantages is we have to take account of individual characteristics thoroughly through guesswork, all those things. Some of the disadvantages like we see high rates of false positivity, of false positives, as well as we have poor inter-rater reliability. It is research oriented. So it is affected by cognitive bias. If one person forensic psychologist is collecting information, he focuses on particular aspects only. The other person will focus for what important he thinks. So we have cognitive biases there found while doing risk assessment there. So if we see the second actuarial assessment, the advantages of this is it is actually well validated research tool. It is most accurate in predicting reconviction. If a person has committed crime again and again, if he is convicted for 7 years of jail, if we again brought out of the prison and we after doing this risk assessment, we'll get to know that whether his behavior is projecting of reconviction or not. So we it is this actuarial assessment is quick and easy way to administer the, as well as it is cost effective in nature. It is used to direct offender to most appropriate treatment. It is it helps to determine most appropriate level of future supervision as monitoring. But there are some disadvantages also. It is not a theoretical one. It underestimates the actual reoffending. It takes it very lightly. Also, the ethical implications is that the offender cannot change. They have those ideas. So it yields to probability, not certainty of reoffending. It does not distinguish between severity of offending. Assesses long-term risk without consideration of factors that could indicate imminent risk. The immediate risk patterns will be left out while doing actuarial assessment. It does not help identify treatment plan to reduce risk. So this was about actuarial management. The third one is third generation program is structured professional judgment. So it deals with advantages like it makes clinical judgment more systematic and increase agreement among evaluators. It's like just like a technical evaluation done between one person and other person for the verification of the test. It is based on sound evidence, provides information to assess treatment planning and future risk management strategies. It is considered to severity of future offending. It identifies factors of risk imminent risk. So disadvantages goes like does not account for readiness to change or responsive to issues, all those things. If it is feeling bit technical, so it is all on the slides you can actually read. So these are the things the risk assessment types can be done. So again, in risk assessment, we do follow the levels of the risk of an individual, like high, moderate level or low, moderate level, based on the assessment we do. Also, there is a need what influencing factors support the behavior as well as the responsivity. How if a treatment is given, how his personality, mental health, and learning styles, IQ will support the treatment. All those things will come in hand. So when we come to the after assessment, when we tailor some particular treatment for a person, it is usually done in a group based program. It is done in 2 to 6 months duration, usually followed half day session, 2 to 4 times a week. We use Socrative questioning, motivation building, social skills, insight building, deep emotional regulation. All those things are done. Okay. So there are, as you know, forensic assessment in our law. There are so many codes like civil code, criminal code, all those things. For a civil cases, forensic assessment mainly focuses on compensation. If a husband and wife has disputes, if a wife takes a divorce, if she needs compensation, she is not working and all, forensic assessment will be done, and compensation will be the main goal. If a person who's mentally ill has committed a crime or he has done some uh, behavior in front of law, compensation will be the main goal. So forensic assessment in civil cases mainly focus on diagnostic, investigative, and therapeutic and rehabilitative measures. So for domestic law related to adults, children including custody evaluation to family court, these are all again a repetition of what. For civil cases, forensic assessment will be done and compensation will be the main goal. For criminal cases, forensic assessment is mainly done for the punishment process. So what do we do here? We do investigative method like DDT, which I'll be covering a little later. Therapeutic to the victims, rehabilitative for offenders, and prevent reoffending, all those things. We check in mental status examination of a person who has committed a crime or the victims, etc. We see his competence, uh, all those things. This are all repetition. So coming back to the last point, DDT. So it should be covered now. Yeah, there is one point called capital sentencing mitigation. Mitigation means if a person has a good deeds, if he has is showing some, insight that he has committed a crime, he has a good behaviors throughout his past, his jail sentences or capital punishment is reduced. That good behaviors are being evaluated by the forensic psychologist. So presently, forensic psychologist role has been explored. All those knowledge, what the information was given, was is being projected in the books as well as the Western world. But DDT, so this is the modern technique which are being used by us forensic psychologists in the laboratories. So this will be explored now. So as I was telling that uh, when a person commits a crime and he leaves no evidence in the crime scene, it is very difficult for an investigation officer to take to generate evidences. So he depends upon the forensic psychologist. So they come in handy by using these scientific tests, which has been tested and verified, and through this we give generate report and it is being given in front of court. So DDT is nothing but it's a modern techniques which is used in forensic lab. It is also known as detection of deception technique. When a person is deception is nothing but telling lie, or he is deceiving the law making body from his misinformation. So we detect deception through scientific techniques. For a person to tell a lie, it is being told in literature that a person takes generally around 3 seconds to tell a lie. He'll process an information. In a daily life, we tell around 6 to 7 lies. When a person is telling a lie, he takes around 3 seconds. But these scientific techniques or these instruments usually detect deception through their physiological as well as psychological variables. So in previous, if we go to the history of detection of deception, since Ayurveda, all those things it is been following. So earlier, when a person who was telling a lie was being subjected on hot coals, hot coal where it was being laid to the ground, and you, if a person is being subjected in front of court, in front of people, he was supposed to walk on that around some around 10 to 15 meters, and he has to confess that whether he has done it or not. If a person couldn't walk on the hot coal and a person denies to do that, he was being subjected as a culprit or so. Through that methods, they used to find a detection of deception. But now, uh, if you see the Persia 500 BC ago, they used to use the fire as a pattern for detecting deception, as well as rice chewing method in China. So in China, they used to bring a culprit in front of the court. I mean, in the king's courtroom, and he was supposed to uh, chew a rice, chew a rice, raw rice, and his he was made to chew, and after chewing the rice, he was made to spit out the rice. After spitting out the rice, if when he opens the mouth, the culprit, if they used to see the pattern of his mouth, if he had a dry mouth or if he had a wet mouth, they used to tell that if he has a dry mouth, they used to tell that he is telling lies, because there are some physiological patterns which has led to the drying of the saliva, and due to it he is telling a lie. If his mouth was wet and is normal, uh, that means that he is not a culprit. All those things were usually done in history. Usually, it was a very torturous method for an individual to go through. But after the innovation of this detection of deception technique, modern technology, it has made human beings to be subjected very easily. Yeah, detection of deception techniques. So, it is a scientific tool which is used to extract concealed information from the storehouse, that is brain, body, etc. So, we gather evidences. So we follow constitutional book, right to remain silent, right to privacy, all those things. Through their consent, we subject them for detection of deception techniques. We assist in increasing the acquittal of innocent. So also, these are the detection of deception techniques which are used all over India. Forensic labs like polygraph, also called as lie detection, brain mapping, brain fingerprinting, brain electrical oscillation signature profiling, narco analysis, suspect detection system, layered voice analysis. These are the technical terms, like how like psychologists use to subject memory, like digit span, like number cancellation, to see his attention, intelligence scale like wrestlers, all those things, how we assess the cognitive variables and all for an individual, if to prove to whether he's innocent or not, we try to subject in front, like detection of deception techniques. So polygraph, the first thing, which is also known as lie detection or truth verifier or truth detector, it usually follows psychophysiological responses, like we measure autonomic nervous responses, where we measure variables like his blood pressures are being measured, his galvanic skin responses, skin conductance. So when a person, now also you see we have some electrical currents running in the our skin. So when a person is excited, when a person is telling a lie, some physiological changes happens, like racing of his heartbeat, dilation of pupils, his breath rate fluctuates, his body shivers, he sweats a lot. All those things, the minute to minute physiological changes are being detected by this polygraph. So how is these variables are being tested? So we ask psychological questions. Based on the psychological questions, the person answers yes or no. Based on that, we get his physiological responses. So why do we subject a person for lie detection? If a person is telling a lie that he has not committed a crime or he was not a witness for it, is denying the fact and all those things, it is the objective of the polygraph is to find the truth or deception of a subject, to identify the deceptive person, to exonerate, to bring out innocent from suspect label, to replace the third degree method. Nowadays, police people, uh, it is being understood that when the person is not telling truth, the police people take them in jail, uh, and they actually deprive them from sleep. They torture them, they actually beat them, and they don't give food, all those things you will be seeing in movies. So to avoid those third degree method, this scientific experiments or this scientific instruments are being used. So polygraph is also done to narrow down the field of inquiry. The investigation or the police officer will be confused why there is no information still generated. So we help in for them to provide clues and direction for investigation officer to identify the perpetrator of the crime. Also to check the veracity or the truthfulness of the statements. That's why we come and do this detection of deception techniques, polygraph. So this is actually a manual mechanical polygraph which is used in the field. So it looks like a briefcase. So you can see the labels like pneumograph in the bottom, which is this is a pneumograph. So which is being attached to the chest, where it measures the respiration pattern of the person, as well as yeah, this is a hand pump which checks the blood pressure of a individual while answering the psychological questions. All those things are recorded in this um, mechanical instrument, and there is a graph generated. So the name polygraph tells that polygraph. Poly means more than two. Like more than two graphs are generated from the physiological uh, patterns of individual. So when the physiological changes happens, all those graphs depicts as it is. So through that, we'll get to know that whether there is a peak of when there is a peak when respected relevant question been asked, we can tell whether he was telling a lie or not. Participation. So now, after the mechanical instrument, now due to modern technology, computer polygraph has been introduced. So this is what we use in our labs, computerized polygraph. Uh, the person is being subjected in front of forensic psychologist who attaches all the parameters like chest, pneumotubes, BP, this skin conductance, all those things. He's made comfortable on this chair before the polygraph test. We make him sit in a pre-test interview, make his mind calm, take his consent according to the Human Rights Commission. We check his voluntariness. We don't force. We tell the pros and cons of this test, and we subject him for the test. So after polygraph, there are many more modern uh, technologies which has been introduced to the forensic psychology. Like in the left side, you're seeing thermal facial analysis. When a person is telling a lie, there is a lot of red patterns which has been come. When a person is telling a lie, there is a lot of blood flow which is being seen on the face, Through that also we can tell a person is nervous, if a person is telling a lie. Also is eye tracking technology also been introduced to the detection of deception. Our eye doesn't actually, it actually tells the truth, they say. So when the eye's pupil dilates, when we don't properly eye contact, when we show nervousness, all those things, detection of deception makes it easy. So the second technique which are being used is brain mapping. So as I told, brain is a storage of storage of all the information. When a person commits a crime, there is a memory. It is a memory which has been stored in a person's mind, which is unforgettable. Because any behavior which is crime related is not it does not happen just like that. It is not driven. It is actually rehearsed in his mind or in her mind priorly to the before the execution of the this thing. So all those information which has been stored in the mind is being extracted by the scientific equipment. So how there is an equipment called ECG, ECG for the heart, electrocardiovascular, ECG, electrocardiogram. So for the heart, the same way there is something called EEG, electroencephalogram, which has been attached to his brain through this electrodes on all the uh, frontal part, parietal part, occipital part, as well as his temporal part. So there are waves generated from inside the brain. Uh, we see the pattern like this. So there is a generation of a wave called P300. The P300, which is actually understood for a memory of participation or a memory related to the crime information stored. So P300 is nothing but a potential positive 300 milliseconds generation of wave is being generated from a brain that is being projected in the monitor. This is how it looks like. So this is actually um, originated from a Western background, Dr. Lawrence Fairwell's technology in 1960s or so. This is how we tell that uh, our brain has a capacity to store of all the information. Uh, this is okay. Next, we are coming for the narco analysis. To speak more about brain mapping, brain fingerprinting. So, if I ask you that, um, do you remember who is your primary maths teacher? So everybody will tell that, yeah, I remember my primary school maths teacher. Will tell their name also. If I tell that, what is the calculation of 5 plus 5? You will tell 10, but you will not remember who taught you 5 plus 5. Right? Like a particular neuron stimulation, like how I asked you the question, who was your primary school teacher? Suddenly a memory.
So your voice is not audible. Participants kindly wait. Seems like there's a technical issue. Seems like there was a technical problem with Sir's end. He'll join back in a few seconds.
Okay, there has been a small power cut in Mr. Mohammad Yassin's place. He'll be back online in a few minutes. I request all the participants to wait for a few minutes.
In the meanwhile, if participants have any queries, you can please type out the question and put it into the chat box so that it can be addressed to the resource person during the question and answer session.
Sorry for the inconvenience. There was a power cut here. Hmm, I think this is like an interval to
Sir, yes,
yes,
sir, you are welcome again. You can continue.
thank,
Yes, sir.
thank you, ma'am. Enter screen. Okay, coming back again to the detection of deception techniques. I was talking about brain mapping. I was also asking about particular questions like how memories, like a particular neuron is will be there. It will stimulate, and that particular neuron generates a memory. The same way, even a criminal or an accused or a victim will have that kind of memory, which will be brought out through the scientific experiments. After brain mapping, we are coming to narco analysis. So it is a invasive method of testing or subjecting to the forensic assessment. So it is also called as truth serum test. So it usually follows psychoanalysis method through psychotropic drug called sodium amythol or sodium pentothal. It is a barbiturate drug. So intravenously we inject through IV lines, and we take him to the stages called uh, awake stage, a trance state, or a sedative stage, or anesthetic stage. So for this narcoanalysis, there is a group of team professionals who are involved, like a psychiatrist, cardiologist, physician, nurse team, as well as a videographer, as a clinical forensic psychologist who take participation, and it is being done. So a person when is injected this barbiturated drug intravenously slowly goes to a twilight stage where his uh, willingness to withhold the information has been disrupted, and when a question is posed relevant to the crime, he blurbs out or he confesses it, and those are the information videographed and presented in front of court. So, in our State Forensic Science Laboratory, Bangalore, our previous assistant director, Dr. Malini ji, has done around nearly 8,000 cases, and this is how a subject is seen when he has been given the sodium pentothal drug. So this person is actually belongs to one of the case called Arshi Talwar case, which is a nationwide case. So there are many movies also being presented in the media. So yeah, so that was narco analysis stage. So we are coming to the utmost for state of art technology methods like fMRI. So functional magnetic resonance imaging is also been studied in Western world, where a blood flow of brain is studied when a person is uh, gone in the fMRI lab, and based on the blood flow and the questions are posed or the images are shown, truth and lies are being distinguished. So as I told this, our laboratory has dealt with nationwide cases like Abu Karim Telegi and Maligaon blast, Arshi Talwar, Abu Kasab, the bomb blast, as well as many cases where some of the cases have also this Kerala famous Sister Abhaya case as well as bomb blast case. Most of the cases, due to our subjecting to this DDT, was upheld in the court, and justice has been prevailed to the families. So, talking about only crime scene, what is the role of a forensic psychologist at a crime scene? So there are some images which might be disturbing for few. So when a person uh, usually see this kind of images, and we should not see as a lay person, but we have to see as a forensic psychologist how they I mean how they minutely see the crime scene details and uh, their environment and what led to this behavior, what all evidence they can generate to the crime scene. We should think about, when we're a forensic psychologist, we should think about from an intruder's perspective as well, not as a general public. So we do involve in psychological autopsy. So usually in medical field they do post-mortem for a body to to see whether there was some injuries internal, or to whether there was any bleeding, or whether there was a act of force, or how was the uh, crime happened. We do psychological autopsy. We actually dig in their mind, like through our scientific techniques. So this is the case study which was very famous, uh, which is called Burari mass deaths case, which happened in Delhi. A mass uh, murder, that's what the media had projected, that had took place in a family where 11 members were found hanging uh, in a home. And so while a forensic psychologist was called, and when he did a psychological autopsy, so it's a it was found that there was an absence of intention to commit suicide. So there were some notes recovered, like there was a Hindi saying that the family had written अंतिम समय में आखिरी इच्छा की, all those things which are written here. So during the last moments, when you are finally making the last wish, the clouds will burst and earth will move, start chanting loudly, I will come and save all of you. So these were the notes, as well as some of the information depicted that all the family members were brainwashed, as well as they followed some ritual which led to this incident. So forensic psychologist opinion was taken in the court, and this case was solved. So these were the things which I wanted to say: their role as a forensic psychologist, what they can do, the scientific assessments, what they can do, the risk assessment, what they can do. But we also have to think in from a mental health professional perspective too. So there were articles in media telling about uh, there are only 6 full-time psychiatrists for 20,000 prisoners in Tihar jail, and no full-time mental health counselor. There is a shortage of psychiatrists as well as mental health counselors for the prisoners who are there. They also have the life, they also have the right to live, and we as a counselors are very shortage in number, and the prisoners are suffering there. So there are only two mental health establishment for all the 16 jails. None of them are registered with either their state or central mental health authority care. As well as there are also news about 100% women prisoners currently are diagnosed with mental illness, and also are accused of offense of psychotropic and narcotic drugs. And these are the facts, and these have been researched and published in the media. There has been 70% increased death by suicide in Delhi in 2016, and 92% of deaths by suicide were under trial prisoners. If they are not listened uh, when they are in pre-trial, they too go through distress, through societal displeasure to them, as well as trauma. And if we, as a counselors, or if we as a psychologist, don't look in a humane manner, they too faces this kind of problems. So as a mental health establishment concern, we all over the country we are not seeing any uh, proper mental health establishment in present. Uh, like that. As you know, the 2021 mental health theme was mental health in an unequal world. So it is nothing but they're saying about an accessibility for mental health services by the families or the clients who want to take mental health services are not being reached appropriately. How can we actually provide them mental health services like that? So most organized and complex crimes, as I said, are rehearsed in minds of preparators earlier only. They don't do instantly, but some of them are rehearsed, and those mind of perpetrators to be read earlier, and you have to deal priorly, and therapeutically we have to solve it. So when physical evidence are missing from the crime, so experiences from the crime remains from the mind and body of culprit and victim. I had told this earlier. And forensic psychologists, we try to tap that storehouse that is mind and body, which leads to the crime scene deception pattern, and through testing we get that information. So what do clinicians do? They actually tap the same mind body which is disturbed, which has some antisocial ideas, and we deal it through our psychotherapeutic methods or counseling. So mental health service is very much required to be addressed emotional and psychological needs for the prisoners as well as convicts, for the juveniles, for the adolescents, problematic youth, and their families for their mental well-being during their custody or imprisonment. So there is a very much need of mental health service for offenders as well as victims. So because of stigma and sympathy, it acts as a barrier for an individual to approach mental health services. Why should we give offenders the treatment? They deserve the punishment. This is what a layperson thinks. But as a forensic psychologist, to think in a holistic matter, we have to reform them and reinstitute in the society by our therapeutic methods. So clinical psychologists, psychiatrists are very much not I mean very much providing mental health services to victims who are seeking medical and mental health setup, but there is no mental health service setups which are established for therapeutic and rehabilitation for offenders and victims as such. So offenders usually feel rejected and condemned, because of which they are deprived of mental health services. They suffer from more serious mental disorders after the committing of crime. So for that, we both victim and offenders suffer mental health issues. Both should be dealt through proper intervention by mental health professionals. So for that, we have mental health care bill as well, where we have a provision for mental health care bill, which was been brought out in 2017. So the act mandates that the state should provide an adequate, efficient, and quality mental health intervention for the prisoners as well. So they are also human beings, and we have to subject them adequately, efficiently, in a quality manner to reinstitute back to the society. There is a section called 103 sub rule 7 that says that the act directs mental health establishments to be done in prisons as well, which shall be registered under state as well as central body board. They should prescribe a standard as well as procedures protocol which will be done to the prisoners. As also the state is obliged under article 21 of constitution, which says that they protect not only physical but also mental health of a person. So forensic mental health service is very much required. So we are needed to follow laws, rules, and regulations with ethical practice of profession. We need to develop clinical and forensic discipline to establish forensic mental health service at hospital setting as well for the victims and their family, because they too go through some trauma which are to be sorted out through psychoeducation, family counseling, and other aspects of mental well-being. Yeah, this is it for this thing. I wanted to go with from the basic. I think I have covered most of it. So any questions to be asked can be asked in the chat box. Thank you.
Thank you, sir. We have a question from one of our participants, Jaina Sushil. When do we,
Yep.
when do we do polygraphs? How can we minimize the effects of the other variables such as stress, inducing nature of the psychologist or other investigating officers?
Can I mean, can you ask one more time? There was a disturbance, sorry.
Yes, sir.
Yeah.
When do we do polygraphs or when we conduct polygraphs,
Mhm.
how can we minimize the effects of other variables such as stress, nature of the psychologists, or inducing investigating officers?
So when do we try to do polygraph? When an investigation officer is being confused or he is being out of information, when he is unable to solve the crime, he actually takes the support of forensic psychologist, and through court permission in front of magistrate, consent is taken, and those crime like burglary or some major crime incidents, those are being brought in front of forensic psychologist to detect whether the person whatever is telling, the statement which has been given to the police is truth or not, whether is deceiving or not. We tell is true nature by testifying in polygraph, this thing. And the second question was about stress, right?
Yes, sir.
uh, Regarding stress, yes, regarding stress to the, if I talk about the client or the victim or whoever brought to the polygraph, we make him comfortable as soon as he comes in to the lab. He's actually stressed. Some people who are confident, who have not done the crime, they come with the confidence and they deal with us very openly, and they genuinely take in test, and their results also project that they were not involved in the crime. But when the person who has been deceiving the police people, when he comes in, he'll be in stress. So when he comes in, we have to uh, take out all the negative aspects what he has already thought about the forensic labs. So we make him understand we don't use the third degree method. We follow the human uh, rights commission guidelines. What are the advantages of taking this polygraph? If you come clean in this test, you are free to go. If you have anything to confess right now in front of us, you can actually give the statement, and we can actually will give it to the investigation officer. That's how the case gets solved. Also, we use some psychological principles like counseling as well as psychoeducation before the uh, polygraph method. And when it comes to the personnel, I mean police personnel, when they are in stress, when they are too much involved in cases and all, we take some awareness program to deal with their work related pressures, and we psychoeducate, or we use relaxation methods, or make them aware, make them prioritize whatever important, how to approach, how to take decisions. All those things are being oriented. I hope I answered the question.
Yes, sir. Thank you. We have another question from Jayashri.
Yeah.
How, as a clinical psychologist, one can assess a juvenile delinquent whether he's able to commit a crime or not without using any sort of instruments? I will repeat the question, sir.
Okay.
As a clinical psychologist,
Hmm.
how one can assess the juvenile delinquency, whether they're going to commit the crime or not, without using any instruments?
Without using instruments. See, I'm also pursuing my PhD from one of the deemed university. So my topic, what I've selected, is like juvenile delinquent population only. So it is one of my interests, and while interacting with juvenile delinquents, for a clinical psychologist, his observational skills, also his interviewing skills, and without any psychometric tests, he can actually use his clinical skills like mm, orienting about his insight, what level of insight he has, or general taking history of his background, clinical history, whether he was in forced juvenile to be introduced to the crime, or his parental background, as well as how his parenting was being brought up. All those things keeping in that mind, we can actually get a profile of about a juvenile. Other than that, other than observational and layman this thing, we should use some psychometric standardized tests to get information, as well as to produce in front of uh, the viewers.
So we have another question from Sukanya.
Mhm.
How reliable are polygraph tests? Can a person fake the test if they have good control over themselves?
Yeah, this question actually is asked many times, as well as it depends on the skill of a forensic psychologist. Of course, those scientific instruments has the verificability, the verificability of 85 to 87%. The research says that a person's deception can be uh, mentioned to 85 to 87%. So rest of the 13 to 15% of the things, the gap is based on the skill of a forensic psychologist. There are some people who claim that we are yoga professionals. We can actually control our internal physiological measures, but the questions what we put in while during the polygraph test are in a such a manner, it's jumbled, as well as it's been how, like when an minimum, what MMPI has been done to test the malingering of a patient subject. We actually reshuffle that again and again, the question, to check the veracity of the information. We do here also. And before the polygraph examination, the subject is clinically interrogated as interviewed. Through that, we'll get to know whether he's able to control his physiological pattern. We'll during polygraph, we get to know his baseline, like if his baseline of his heart rate per minute was 72 beats per minute. While testing, while asking the question, if his heart rate goes to around 780 or so, something like increases or decreases, those minute pattern, as well as his micro expression, like functional body language, behavior, are all been observed. Through that, we can actually get. The polygraph is just a screening test. So through that, if we get some of the clarity, we go in for a brain mapping. In brain mapping also, one of the next step after polygraph. After that, brain mapping, if we get some memory pattern of that person involving that crime, we go to the narco analysis. And the same way, it's like a battery. We do test and we get actual information.
Thank you so much, sir. I now request Sister Mari Evelyn to propose the concluding remarks.
Good afternoon, everyone present here. Thank you, Mr. Yasin, the resource person of the day, the clarity with which you handled the subject. Only a person who has worked in the field could do this task very effectively. Forensic psychology was once upon a time a foreign topic to many of us, including psychologists themselves, although it was an applied branch of psychology. We had a number of doubts about the subject, but you, sir, has enlightened us with practical situations handled by a forensic psychologist. Eyewitness testimony activity gave us an idea the alertness with which one needs to function, the keen observation he needs to have to function effectively. Thank you, sir, for dealing with the topic systematically, saying what is forensic psychology, the history, its contributors, and the knowledge base, clinical psychology, criminology, law, sociology, psychiatry, and penology. Assessment, vast although the range of cases they need to deal with, the skills needed to be possessed by a forensic psychologist. You also brought out the difference between psychology and forensic psychology. We also realized the various roles one has to perform, be it assessment, evaluation, report writing, treatment, rehabilitation, and research. In general, we exclude people who are involved in legal issues, criminals, social offenders, but we realize that forensic psychologists work with such people whom society rejects. We have also realized the importance of psychology and its application in such situations while trying to understand the offender and rehabilitating him or her. You have helped us to appreciate the role of psychology in problem behavior. You have opened the door wide to see where and how the knowledge of psychology can be applied. Theories of personality, therapeutic approaches can be used. For example, ABC model, the role of cognition. You have touched upon so many aspects of behavior and connected it to assessment, which is quite complex because clinical judgment is usually coordination of various findings, both subjective and objective. PDT technique, although seems very interesting, it's a very risky job as one has to generate evidences in the absence of any clues. To extract concealed information is also not an easy job, but surely a challenging task. Thank you for not only explaining the procedures of assessment, but also showing the pictures and its operation. It gave us an understanding of the complexity, accuracy, objectivity of the assessment. Crime seems maybe disturbing, but a forensic psychologist has to withstand it and do psychological autopsy. The dearth of mental health professionals will surely inspire many to join the area and be of help to people in distress. And you have already triggered the interest in all our budding psychologists. Thank you once again, sir. All the best.
Thank you so much.
Thank you, sister. I now request Ms. Vinuta CV, Assistant Professor in the Department of Psychology, to propose the vote of thanks.
Gratitude is the healthiest of all emotions. The more you express gratitude for what you have, you will have even more to show gratitude for. A very good afternoon to one and all. It's my immense privilege to propose vote of thanks on this session. I, on behalf of Kateel Ashok Memorial College and the entire participants, would like to extend my hearty vote of thanks to the chief speaker of this session, Mr. Yaseen M G, Senior Scientific Officer at Forensic Psychology Division, State Forensic Science Laboratory, Bangalore, for giving an excellent coverage on Foundations of Forensic Psychology. Thank you so much, sir. We would like to express our sincere gratitude for Dr. Rajni A. Pai, Director of Manasa Group of Institutions, Dr. Preeti V. Shanbag, and the entire management for their constant support and encouragement in the organization of series of special lectures. We also express our deepest sense of gratitude for Dr. Sandhya Kaveri K, Principal of Kateel Ashok Pai Memorial College, Shivamogga, and Sister Mari Evelyn, Coordinator of PG Studies and Research in Clinical Psychology, and Dr. Archana Bhatt K, HOD at the Department of Postgraduate Studies and Research in Psychology, for their constant support and guidance. We are
Thank
also
you,
thankful
Vinuta.
for all the teaching and non-teaching staff of Kateel Ashok Pai Memorial College for their technical support and cooperation which facilitated in the smooth running of this session. Last but not the least, we would like to convey our heartfelt gratitude for the participants whose presence and active participation graced this session. Thank you one and all.
Thank you, Vinuta. I request all the participants to please fill in the feedback form. And once you fill the feedback form, you're all allowed to leave the session. Have a good day.